Hey everyone, Debbie Reed here, Think Healthcare Solutions, Trust About Healthcare, and the Healthitude Academy. Welcome everyone. It's been a few days. I'm a slacker. Can you believe it? And it's Saturday, and sorry for the way I look, but if I don't do it now, I won't do it at all. So, let's get to it. Episode 18, Ask a Frustrated Nurse. I almost said angry, but I'm not there yet. Okay, the thing that grabbed my eye today as I perused opportunity to share with you how many physicians have exited mission since HCA took over. A watchdog says 200 plus. Well, let's dive into this. So HCA is one of the bigger hospital corporations, and they're getting bigger by the moment. I think they're going to do what they did back in the 80s and go across the country and buy out everything and then go, uh-oh, what have I done? And I'm hoping so, because what I'm feeling in this article is that they are getting too big for their britches. And coinciding with my feeling on healthcare as it stands today, I'm anti. And I grow anti every day because of so many of the big big players in the mix. Pharmacies, insurance companies, hospital groups, what else? On and on. I mean, everything costs, every time a new thing comes out, it's a gazillion dollars. I mean, we've lost our minds. Anyway, on one hand, we are grateful in this great country to have the technology and the improved treatments and therapies and bells and whistles and all that stuff. But on the other hand, it comes with a great price. Sad state on the site. Sad note, I saw an article talking about telehealth, telemedicine, which they're now concerned that CMS, Medicare, is going to go, oh, and they're going to kind of go back on some of the stuff that they've opened the door to. And I'll follow that on a different episode. But getting back to this article, there's a few different layers on this that are disturbing to me. For many years I thought that HCA, although none of them are perfect, I value that HCA had integrity. But over the years, the term revenue integrity has come with its flaws, and I question that even being a thing as far as hospitals go, billing practices, and on and on. Having said that, let's move into the actual nuts and bolts of this article. So this Mission Health System was purchased and finalized in February of 2019. And since then, the overall census is that 200 physicians have left the building. There's a few that have stayed on as staff for privileges, but for the most part, there's apparently a big exodus, including leaving the state, moving on to other places, and the like. HCA refused to give actual numbers. The media specialists skirted around the questions. I'm not impressed with that, which leads me to, having additional concerns as these physicians do. One great doctor, he's an oncologist, he had worked with Mission. He left Mission in December of 19, which is short, a few months after the purchase. He joined a different cancer center. Said the hospital system before HCA was run primarily by doctors and nurses, and now it's being run by businessmen, which there is truth to that no matter how you spin it. But I do agree that healthcare has become more of a business and less of medicine. So I agree with him on that. Bedside care is knowing what patients and families are suffering. Patient suffering is the HCA management radar. You know, he could be potentially unhappy, but there is still some volume and some value to what he's saying. He said that the hospital needs more doctors and leadership. We need the right balance between bedside care and corporate benchmarks and revenue. And it's also noted that he's now the elected president of the North Carolina Oncology Association. And then another doctor, Dr. Aiken, a primary care physician employed by Mission until January of 2020, so he went almost a year, said many patients are skeptical that HCA has their best interests in mind as a for-profit company. He goes on to say that he piloted a subscription fee direct primary care practice under Mission's former leadership, and said Mission used to employ more primary care doctors even though that specialty is less profitable. Shut 2 primary care practices in 2020 and in Biltmore and Chandler, and sold Aiken's pilot program, now called Lantern Health, to Dr. Aiken. I think that's pretty chicken, but anyway, good for him. Another direct primary care group. At least 30 primary care or family medicine doctors and 10 internists have left Mission's employment, according to the Asheville Watchdog. Aiken also said Mission Long was able to recruit high-quality physicians to Asheville, considered a desirable place to live and practice. But he said the type of physicians that were attracted to Mission may not be attracted to HCA. The business approach is very different. So the CEO pledged that we would have the same doctors when this purchase was taking place. An emergency room doctor spoke on conditions of being unknown. He said Mission before HCA could be choosy about the doctors it brought on staff because so many wanted to work there. Now they just fill the gap. They're stating that the doctors are caring for more patients while management concentrate on meeting minimum standards and metrics such as how long a patient waits to be seen, which is true. They're doing a lot of metrics and that kind of stuff instead of focusing on patient care, in my opinion. There needs to be a balance, of course. You don't want to sit and wait forever and ever. But anyway, when HCA came in, there was so many emails on Matrix. He said, we've gone from providing amazing care to mediocre care. Aiken said he wants to see a high-quality hospital in Asheville, but believes Pardee, UNC Health, and Advent, both in Hendersonville, are likely to expand if skeptical about Mission continues. The HCA goes on to say, hey, everybody's great. They're all board certified. You know, we had a great review from their standard of the state accreditation with no corrective required, which, again, depending on the dates, they probably, where's the credit? Did Mission have it, was already pre-ready, or, I don't know. She said that hospitals nationwide are struggling to hire and retain doctors, a shortage exacerbated by the pandemic, blah, blah, blah. And that it's welcomed almost 60 new physicians to our staff in 2021, not addressing how many they've lost. In May of 2018, before the sale of the hospital system, Dr. Ronald Paulus, then president and chief executive officer of Mission Health, told a local business group that Mission Health under HCA would still have the exact same people and the exact same doctors and the exact same nurses and provide similar or even superior care. This is where I about lost it. Paulus received a multi-million-dollar payout for mission and joined HCA as a strategic advisor just days after the sale was concluded. Staffing concerns. I mean, it goes on and on. HCA and corporate ER staffing groups figure they can get away with a minimum of physicians, said this Dr. Lai, who now operates a private direct primary care serving Asheville, Black Mountain, and nearby communities. So ER doctors are leaving hospitals to do direct primary care. Dr. Zamkoff, a retired hematologist at Asheville, said, when a patient is lying in a bed, it's not just the doctor, it's the whole team that cares for the patient. If you don't have nurses, CNAs, and the whole auxiliary staff, you can't do it properly. When you decimate the team, the patients suffer. A former mission doctor who still has privileges there said the reduced staffing places a burden on those still practicing at mission and leads to an erosion of quality. Before HCA, he says, staff included many longtime employees who had worked together for years, but now there's no consistency. And they're throwing out the vote of no confidence. The Attorney General for the state is having his second thoughts about letting this purchase go through. There were 15 key things that the HCA promised to do, and they're really questioning whether or not that this is actually going to be a sad state of affairs to see what's going on with the healthcare situation. And again, North Carolina Attorney General Stein says that with the 15 conditions, I mean, the sad thing is when it's all said and done, HCA's profits are soaring. Now, and I get it. I mean, it takes money to make money. You can argue all this stuff, but I think healthcare, while there's a lot of things that can be great, this is one of the arguments for the fact that they've taken the doctors out of the equation, not allowing them to have hospitals. I think that there needs to be a mix, just like I think that there needs to be a mix of players that can actually redesign healthcare to make it work more efficiently. But it's not the leaders at the insurance companies, it's not the leaders of these hospital corporations, it's not the leaders of the insurance companies, but it is some players and people that know healthcare, that know how to give and receive healthcare, that can really make a difference on how healthcare is changed. But until that happens, we're stuck with this mess. And it just calls to mind my opinion of we the consumer and what we need to do. We need to do our part. And we need to look long and hard at how we receive our health care. What I'm seeing from my perspective is that so many of us as consumers are used to, here's my insurance card, take care of me. Well, that insurance card could potentially costing you way more than the card is printed on. Meaning, it's my Carnival. Meaning We're paying more for our health care than we need to. And we're not watching out how we're spending it. We whine at the gas pump, but why are we whining at the line in to get our drugs, to get our health care, for any of it? And then wonder why we get a bill after we think all of our insurance has been paid. And I cannot, the thing that Dr. Glockenflecken does, it says it's precious. And it's so true. It's enough to complicate things so that we, the consumer, don't understand what we're getting sucked into. Closing comment. There's more stuff, but closing comment. If you needed a colonoscopy, your insurance, if you go through the insurance route, potentially it's going to cost you a lot more than if you pay cash for it somewhere. So you're willing to pay all of your out-of-pocket expense on a single colonoscopy. Let's say you have a $5,000 deductible. And it's probably going to cost you close to that to have that done when it's all said and done. When you can have it done anywhere from, I don't know, I'd have to look it up again, anywhere from, let's say, $800 to $2,100. You can look at it this way. Hey, I met my deductible, but hey, what if that's the only thing you have done that year? And you spent all of that extra money when you could have done it a whole lot cheaper. I'm trying to reprogram you guys to think, and think like you were a coupon cutter at going to the grocery store. Not being ridiculous, no. But, and they're just as wonderful. I mean, the direct primary care doctors, they're there for you. They're not just there for the dollar. They get to know you. You have a relationship with that doctor, that provider. You're not just a number at the hospital doctor's office that have all of the rules of law in place. I'm not saying that we don't have rules, so don't mistake what I'm saying. There are some amazing opportunities out there for us to get health care differently. And I hope that the stuff that I bring to you will encourage you to rethink your health care and to be more mindful, like when you go to the grocery store, of the cost. And you don't have to sell out quality for quantity. And a lot of times you're getting more quality or as good quality, this different model than if you are going to the big box store. You don't buy everything at Costco. There's certain things that you can get better at some other places. Costco's handy. Costco's great. But anymore, the big hospital corporations, you're not getting value anymore. Please consider what I have to say. Please go to our website, check out your options. Have that conversation. We'll do a consultation and discuss things more, your specific needs, and how you can capitalize your dollars. They're yours. They're not your insurance companies. They're not your employer. They're yours at the end of the day when you're having to fork out that extra amount because the insurance paid wrong, the hospital billed wrong, on and on and on. The doctor made a mistake. Are we willing to just because medicine's become up on this pedestal that we just whatever they say? No. As we've known and learned over the last 2 years. Please consider this. Follow us. Get more information. Become involved. Become informed like you've never been informed before. Take that time. It could cost you, it's peanuts compared to what you're spending in your health care. Consider the options. Think long and hard, moving forward in your healthcare choices. Call us.